Well, a local doctor has returned from the front lines helping COVID-19 patients in New York City. When he heard the calls for help, he knew he had to go. News 8 Now's Mal Meyer explains how lessons learned from more than 1,000 miles away will help patients here back at home.
When New York started reporting a wave of patients, Dr. Jeff-Jensen wanted to help, but Mayo-Clinic-Health-System was preparing for its own wave of patients. When that didn't happen, he knew it was time to go.
Daily number of people in ICUs across our public hospitals for suspected COVID-19. That went down.
When Dr. Jensen arrived at the end of April, the city was starting to see progress.
I found a healthcare organization that was overwhelmed, but it was at a point where they were slowly catching up.
He oversaw a makeshift intensive care area at one of New York City's 11 public hospitals.
All of those patients were on ventilators. All of them were sick.
He says there were 24 chronically critically ill patients, meaning they were stabilized but debilitated and required a lot of heavy care.
Many patients had kidney failure. Many patients had strokes. Many patients had clots in their veins and their arteries.
Not all survived.
Unfortunately, through this process, even in the 2 weeks, I saw a number of patients die. A lot of these patients die with no family at bedside.
Only the staff that cared for them. But he wasn't just there to care for patients, but the staff too.
Clearly, everybody locally was exhausted emotionally and physically. So I was able to fill in as an intensive care doctor for the 2 weeks I was there.
But because of an influx of visiting medical professionals, he says sometimes there were disjointed patient plans, which may have caused them to not improve as quickly.
A couple of days, a visiting doctor would come in and do what he or she thought was the right thing to do. Another doctor would come by and maybe make that plan change.
So he worked to get clarified, consistent plans. It's one of the many lessons he brought back from his time in New York. If we get a sudden surge of cases.
If this happens to us, how are we going to try to avoid the burnout?
He says while a lot has changed from the beginning, one thing remains the same.
The risk is still there. It hasn't gone away.
After what he saw in New York, he's urging people to keep wearing masks, washing their hands, and avoiding large gatherings. That way we can keep flattening the curve so other hospitals don't get overwhelmed. In La Crosse, Mal Meyer, News 8 Now.
Dr. Jensen says if there is a second wave, there could be a call for volunteers again. He said he would be willing to sign up again if need be.